Every morning, millions of Americans brush their teeth with the same paste they have used for decades, rinse with the same blue mouthwash, and take the antibiotics their dentist prescribed, and still, the bleeding comes back. The pain comes back, the embarrassment comes back. So the question is not whether those treatments work temporarily. It is whether they are actually solving anything at all. And today, science has a very clear answer. You might not like it, but you need to hear it. If you brush twice a day and still have cavities, still have bleeding gums, still feel that metallic taste in your mouth every single morning, this video will explain exactly why. And more importantly, what the research from institutions like Harvard University and São Paulo State University says you should be doing instead. Let us start with what most dentists will tell you. They will say that gum disease is caused by bad bacteria, that the solution is to kill those bacteria with antibiotics, with chlorhexidine rinses, with deep cleaning procedures that scrape and disinfect every pocket of your gum tissue. The logic sounds reasonable. You have an infection. You kill the infection. Problem solved. Except the problem is never solved. Not for long. Dentists know this. Patients know this. Studies know this. Up to 69% of patients who undergo standard periodontal treatment experience a return of biological complications within 10 years. 10 years. Imagine spending thousands of dollars sitting through painful procedures, following every instruction, and then watching your gums deteriorate all over again within a decade. So why does this keep happening? Because the conventional approach is targeting the wrong enemy. About 2 years ago, a group of scientists took a much closer look at what actually causes gum disease to develop in the first place. What they found turned the standard model of dental care completely upside down. Published in part through the Journal of the American Dental Association. Their conclusion was striking. Gum disease does not happen primarily because there are too many bad bacteria in the mouth. It happens because there are too few good ones. Think of it like this. Inside your mouth, there is an invisible ecosystem, a living community of bacteria, fungi, and microorganisms that scientists call the oral microbiome. And just like any ecosystem, what keeps it healthy is not the absence of predators. It is the strength of the defenders. When the good bacteria are numerous, diverse, and well-established, they neutralize harmful organisms, carry essential minerals to your tooth enamel, feed oxygen to your gum tissue, and regulate the entire chemical environment of your mouth. They are the immune system of your oral cavity. When they are gone, everything falls apart. Now here is where it gets uncomfortable. Because the research points to a very specific cause for the destruction of these good bacteria, and it is not sugar, it is not genetics, and it is not age. It is the very products that most people use every single day to protect their teeth. Take the most common. Example, standard toothpaste. Many of the most popular brands contain an ingredient called sodium lauryl sulfate, a detergent-based compound originally developed for industrial cleaning. When applied to your gums twice a day, every day, it does not distinguish between bad bacteria and good bacteria. It simply strips the oral environment of microbial life indiscriminately, the same way bleach strips. The stain disappears, but so does everything else. Then there is chlorhexidine, the active ingredient in many mouthwashes. A 2020 study found that healthy individuals who rinsed with chlorhexidine mouthwash experienced measurable increases in oral acidity and a significant rise in blood pressure. Because good bacteria also play a role in regulating nitric oxide, which directly controls vascular function. This is not a fringe finding. This is published science. And then come the antibiotics. Every time a dentist prescribes a course of antibiotics for a gum infection, the medication does what it is designed to do. It kills bacteria. The problem is that it cannot target only the harmful strains. It wipes out the oral microbiome broadly. And because the patient is still using the same detergent-based toothpaste and the same disinfecting mouthwash, the good bacteria, the ones that would normally repopulate and rebuild, never get the chance to recover. The mouth is left in a biological desert. And in a desert, nothing grows but the most resistant, opportunistic organisms. The bad ones come back faster than the good ones. Every time, this is the cycle that keeps people returning to the dentist year after year. Spending money on treatments that treat symptoms without ever addressing the root cause of the problem. If this resonates with you, leave a comment below telling us where you are watching from. And if you know someone who has been going through this same cycle of treatments and disappointments, share this video with them. It might genuinely change their life. Now, once you understand the real mechanism behind gum disease, the depletion of the oral microbiome, the direction of the solution becomes obvious. You do not need to kill more bacteria. You need to rebuild the community of good ones. This is exactly what a new field of oral health science is focused on. Researchers from the University of Otago in New Zealand identified a specific strain of bacteria called Streptococcus salivarius, now known in the literature as Salivarius A2, that was found to provide robust, long-term protection to the immune environment of the oral cavity, the ear, nose, and throat. Separately, scientists from São Paulo State University conducted extensive trials on a strain called Lactobacillus reuteri, a probiotic so powerful that over 220 clinical studies have been performed on it across approximately 19,000 subjects. In those studies, Lactobacillus reuteri was shown to inhibit the reproduction of harmful oral bacteria by up to 86%, even in its non-living form. It was shown to increase gum healing time by 46%. Another clinically validated strain, Lactobacillus paracasea, was shown to clear Streptococcus mutans, the primary bacterium, responsible for converting dietary sugars into the acids that corrode tooth enamel, while simultaneously reducing the inflammatory response associated with allergic rhinitis. At least 5 clinical studies confirmed significant improvements in airway health, in addition to oral health outcomes. Then there is Bifidobacterium lactis, which researchers have shown accelerates the absorption of calcium and essential minerals into tooth structure, promotes gum pocket closure, and supports the reattachment of gum tissue to the teeth, effectively reversing the physical damage caused by years of microbiome depletion. But here's the critical piece of information that most people miss when they think about probiotics. A probiotic pill that you swallow goes directly to your stomach, where up to 96% of the live bacterial strains are destroyed by stomach acid before they ever reach the mouth. You cannot rebuild an oral microbiome by delivering probiotics to your gut. The good bacteria need to be activated in the mouth in contact with saliva so they can colonize the gum pockets, tongue, the palate, and the tissue around every tooth surface. This is why the delivery format matters as much as the strains themselves. The most effective way to introduce these beneficial organisms into the oral environment is through a slow-dissolving format that keeps the strains in direct, sustained contact with the saliva and soft tissue long enough for them to activate and multiply, and begin the process of reculling when the oral microbiome is restored, when the good bacteria are numerous, diverse, and well supported. The body does something remarkable. It begins to heal itself. Gums stop bleeding. Inflammation recedes. Tooth enamel begins to remineralize. Breath improves without artificial masking agents. And because every swallow seeds the gastrointestinal tract with roughly 140 billion microorganisms per day, the downstream effects extend well beyond the mouth, improving digestion, clearing sinus congestion, reducing allergy reactivity, and supporting more restful sleep. The science is not new. It has been building for years. What has been missing is not the evidence. What has been missing is the willingness of the Indo industry to acknowledge that the products generating their repeat business are part of the problem. So, the next time someone hands you a prescription for antibiotics or tells you that, the answer is more scaling, more rinsing, more stripping of the very biology. Your mouth depends on you now have the context to ask a better question. If you want to learn more about how to restore your oral microbiome and give your gums and teeth the environment they need to heal, the link is in the first pinned comment below.